Hi, and welcome to Community Voices brought to you by Mainline TV. I'm AnnaMarie Jones. Today's guest, Rebecca Lewis, is a PharmD MBA in healthcare business and vice president at Tabula Rasa. Tabula Rasa is striving to lower the risk of adverse drug events in various patient populations. And Rebecca is here today to tell us about how Tabula Rasa is working to achieve this goal. Rebecca, thank you so much for joining me today.
Thank you for having me,
Yes.
AnnaMarie.
It's my pleasure. I want to know, Tabula Rasa means clean slate, right? So why is the company named Tabula Rasa?
Sure.
And why was it founded?
Yeah, so Tabula Rasa was founded on the premise that there's a better way to determine which medications are appropriate for patients, right? And prescribers woefully don't have the tools that they need. Blank slate or clean slate is the idea back from the Roman times when folks would heat up a tablet and make it new again, a tabula rasa from Latin. And the idea of the company is a fresh start, a transformation for how medication information is provided to prescribers.
Wonderful. And can you explain, as if I were a patient, the MRM matrix, and how would I benefit from that as a patient?
So the medication risk mitigation matrix is just that. The idea is that we are working to mitigate risk associated with medication regimens. And there's a lot of risk. We have a growing problem in this country in terms of medication prescribing. And there's a lot of reasons for that. But if you look at the data in the past 20 years, there's been a huge increase in the amount of medications that the average patient is taking. So, in 20 years, up from 14% of patients taking 5 or more medications to 42% of patients taking 5 or more medications. And as you add medications on to a regimen, you increase the risk associated with having an adverse drug event. So with the medication risk mitigation tools and the proprietary technology that Tabula Rasa has developed, we are looking at how those medications work in a simultaneous multi-drug analysis versus the very traditional way of one-to-one drug interactions.
So let's break that down a little bit. So how would that benefit a patient, and is there someone that they would have to get this through? So it would be a doctor administrating this for a patient, is that right?
So the technology that we've developed is pharmacist-centric. There's training and certification that is required to be able to use the tool. And it's pharmacist-centric because it's what we rely on clinical pharmacists to do in terms of evaluating how medications are used by a particular patient. However, the pharmacists are working in concert, of course, and providing the information to physicians or other prescribers, extender prescribers, to be able to make sure that they have the right information and to determine the appropriate therapy for a patient. And we're doing that in a number of ways with different populations. One of the populations that is most at risk is a growing population in this country, the elderly, of course. They're on a lot of medications. And one of the challenges is that there's no quarterback, if you will. There's no one overseeing all of those medications. So if a patient sees their general practitioner and then also sees a cardiologist, pulmonologist, perhaps they're hospitalized and they're discharged on another set of medications, the information isn't housed in a single place. So we are working with provider groups, with payers who have a lot at stake, a lot of risk associated with the outcomes with their patients, to do those evaluations and, when we can, prospectively intervene in terms of what medications would make the most sense.
Okay, so I see. So it's centralizing all that data.
Correct.
All that information. So it could be accessed by the doctor, but the pharmacist is overseeing that information.
Exactly.
Okay, great. And is there an app for that?
Well, there's a lot of utility in an app. We've certainly been asked about that. The idea that a patient would be able to write in their prescriber, prescriber's office, if they were even in an emergency room or in a pharmacy themselves, adding a medication, that they would be able to play in the sandbox almost and say, what would happen to my risk if I added this medication or if I discontinued that medication? There's utility perhaps with people who are caring for elderly loved ones or children, being able to access their regimens and the risk associated with their profiles. So all of that is in the works, but doesn't exist today.
Okay, great. I mean, it would be a game changer if we all had access to drug combinations and how they affect us and whether or not we could take something, because sometimes you read that the drug interactions on a label and you might forget, but if you can go straight back to your app or you throw away the bag and you no longer have the drug interactions, if you had it on an app, it would be so easy to track.
Absolutely, and it's so much more than drug interactions. What we're focused on are adverse drug events, and these are problems that happen associated with medications when people take regular doses of medicines prescribed by their physician or healthcare provider, but something negative happens. And it's not because the dose was wrong or even perhaps that the medication was wrong, it's because of the way those medications worked in the body for that patient. And there's a lot at play there in terms of the pharmacogenomics, pharmacogenetics of how medications work, even the chronopharmacology, that is the time that medications were taken.
So if you had a patient's genetic profile, you can see how the medicine would interact with them versus another patient, or each patient would have their own information on how that drug will affect them.
Yes.
That's fascinating.
Yes, very specifically with a cheek swab, we're able to profile those enzymes that are available for your body to metabolize medications.
That's really cool. That's really, really cool. So you mentioned that patients who you're working on this with are the elderly. Are there other patient populations that you're interested in exploring this technology with?
Well, one other very important population are patients who are on long-term opioid therapy. So patients who have chronic pain syndromes or other medical needs that would cause them to be on those medications. And the challenge there is depending on how you metabolize those particular medications. So you inherit those genes from your parents, right? You might metabolize too rapidly, or you may metabolize too slowly, or depending on other medications that are part of your regimen, you may not metabolize the medications at all. The opioids, there's a crisis, of course, as we know, in the United States, and we believe that some of that is impacted simply by other medications and the genetic profile that patients have.
So interesting. Now, is there anything else that you'd like to share about pharmacodynamics and what patients should be aware of?
So I think in our culture, we're really in a culture of prescribing, right? And there's a lot of data out there to describe why that is. One is that we're at the 25th year of direct-to-consumer advertising, right? So there's a notion that there's a pill for something or a pill for everything. There's data out there that says if you go to a physician or you go to a healthcare provider and you don't leave with a prescription, that you may believe you've had a suboptimal experience. So there's a lot of reasons why medication prescribing is proliferating in this country. And there's a risk associated with each of those medications that you put in your body. So it's very important to make sure that you know what all of those medications are, that you're speaking to your prescriber and to your pharmacist, and if there's a particular risk in a chronic population, that you're seeking perhaps pharmacogenomics to see if that's at play for you.
Very cool. So take us back to how you got involved in all of this. Obviously, you have your PharmD and your MBA. Where did you start out on this journey in helping to found this company?
Yeah, so for many, many years, 20 plus years, I've worked with a group of folks, two pharmacists in particular, whom are our president and CEO. And they're both pharmacists by training and are absolutely, have always been passionate about how medication can be optimized in patients, and that we're really not doing enough to make sure that medication is used safely. We, in the middle 90s, started a company to focus on the hospice population, hospice and palliative care. So we looked at how medications were used in that very frail, sickly population where there's not a lot of time to have an intervention and to really improve outcomes for those patients. That company was very successful, and from there we were approached by that industry to kind of go, I'll say, upstream with the PACE population. And those are the programs for all-inclusive care for the elderly. In Pennsylvania, they're the LIFE programs. So the idea was that they're an elderly, frail elderly population. These are patients that would otherwise qualify for nursing home placement. And the goal of the PACE or LIFE programs is to keep the patients safe and comfortable in their home for as long as possible. And it was such a good marriage of what we were doing in terms of creating safety around medication use and optimizing outcomes with this population. So we really got our start there and have subsequently expanded to other very large populations.
Okay. Very interesting. Thanks for sharing that. And so since this is not a direct-to-consumer type of product or technology, how would someone watching find out more about how they can take advantage of a program like this?
So today it isn't available, as you suggested, AnnaMarie, direct to consumer. So it's a matter of one's insurance company taking responsibility, really, is where it lies today. So
so it's really the insurance companies that are seeking to have a relationship with Tabula Rasa.
That's correct, and also with patients. And what we're doing is helping those payers, specifically of the pharmaceutical benefit or of the medical benefit, identify those patients that are at the greatest risk. So the medication risk mitigation tool assigns a score to an individual patient. So we can take large populations and find those patients that would most benefit from an intervention.
Very cool. Is there anything else you'd like to share with us?
I'm delighted for your interest. It's such a niche industry that we are in to focus very specifically on how medications are used. So I just appreciate your interest and the interest of the community.
Well, I couldn't be more thrilled to discuss this with you.
Thank
and
you.
Thank you for coming today.
Thank you.
Yeah,
Thanks
and
so
teaching us about what Tabula Rasa is doing. And if you'd like to find out more about what Tabula Rasa is doing to help with lowering the cost of interactive drug, how would you say?
Reducing risk associated with
drug
medication
adverse
use.
events,
Yes,
right, exactly. Then you can just go to the company's website. It's tabularasahealthcare.com. So I just want to thank you very much for watching our show today, and I look forward to seeing you next time on Community Voices. Take care.